And it's interesting you mentioned the healthcare community and kind of the false choice that was set up between you got to do one or the other. You know, it's an and situation. We have to do both. Our case count is creeping up, as you know, headed sort of in the wrong direction. We've been involved, obviously, in our region with the One Region Ready program that we've spun up, and really in conjunction with MUSC, just over the past week, we've started sort of doubling down on the messaging regarding masks and social distancing, hygiene, and all, and the large crowd kind of conversation. Do you see a understanding that the governor has stopped short of mandating? Do you see a situation where 5 or 6 weeks from now, if things don't improve, the legislature could step in and say, hey, we may need to pump the brakes on things a little bit?
I really don't, Brent. I don't see us. Of course, you know, you never say never. We started this conversation with saying this is a completely unprecedented issue that we're all having to work through. So I never say never. However, given that and the knowledge that we are gaining every day, certainly the uptick in cases is not a good thing. It's not something that we necessarily like to see. At the same time, the flip side of that, I've been talking with healthcare professionals in our own community at the hospitals and local physicians and the like. And the good news about this is that while, yes, the uptick is there, what our healthcare providers are seeing is that the people that are coming to them, whether it's in hospital or the doctor's offices, are dealing with it much better. The recoveries are much better. And it's not as a difficult of a road to hoe. And I think we like to get caught up in numbers. And as you know, we can make numbers say whatever we really want them to say. But while the numbers are going up, the real challenge and the concern that we had nationwide going into this thing was we didn't want the numbers to get to a point where they would overwhelm our healthcare service. And that never happened. That never happened here in South Carolina. We always had some smooth, some buffer there. So we were never overwhelming our hospitals, our medical facilities. That still remains the case. I don't think anybody ever said that there wouldn't be a number of people that wouldn't contract this issue or this disease or this virus. What we want to do is make sure that we're able to care for them and get them healthy again. And I think that's what we're seeing. So unless things get really bad, unless we start seeing the taxing of the healthcare systems, I don't see an instance where we'll come back and lock things down to the extent that they were locked down before. I don't think that's good for people. You know, a strong economy, you can make the argument that a strong economy is going to do as much to prevent healthcare issues and deaths of people than a virus will. We need to be able to eliminate poverty and keep people working and have people that have something to look forward to and be able to afford healthcare and all those different things. And that comes with a strong economy. So I hope we don't have to get to the point again where we're pulling that economy back and causing more hardship.